Welcome to Demystifying PANS and PANDAS, the podcast where we uncover the mysteries, breakthroughs, and hope behind these life-altering conditions. I'm Dr. Nancy O'Hara, a board-certified pediatrician, educator, and advocate with over 3 decades of experience helping children and families navigate the challenges of neurodevelopmental and neuropsychiatric conditions, especially PANS and PANDAS. These disorders can feel overwhelming, but here we'll break down the science, explore transformative treatments, and share stories of resilience and recovery. If you've ever wondered what's possible for your child or how to find answers, this is the place to start. Let's dive in. Well, I am thrilled to welcome Dr. Debby Hamilton to the podcast. Debby is a pediatrician with experience in primary care, integrative medicine, research, speaking, and writing. She's a board certified in pediatrics, physician nutrition, integrated and holistic medicine from the AIHM, and functional medicine, IFMCP, the Institute of Functional Medicine Certified Practitioner. She has a Master's of Science degree in public health, where she did research in nutrition. And Dr. Hamilton founded Holistic Pediatric Consulting in Colorado in 2005. Her practice focuses on treating children with chronic diseases such as autism and ADHD, and preconception counseling based on her book, Preventing Autism and ADHD, Controlling Risk Factors Before, During, and After Pregnancy. Her book led to her collaboration in writing of the Healthy Child Guide through the Neurological Health Foundation, where she's on the executive and scientific board. Dr. Hamilton's also an employee of NutriMedics, where she's director of product education and clinical research. Debby, thanks so much for joining me.
Oh, well, thank you for inviting me. I feel like this is an interview, but also maybe even a discussion about this issue.
Yeah, absolutely. And, it wasn't until I read your bio in preparation that I realized how much we really have in common. All of the where we got started, the master's in public health, the functional medicine certification. But, you wrote a book long before I did. And it is a great book for anybody who hasn't read it, Preventing Autism and ADHD. And I also was looking at a couple of the articles you read. I had seen the mitochondrial dysfunction one in the Towson Letter a while ago, but I just read the disruption of established bacterial and fungal biofilms, which came out, I think, last year now, but 2023.
Yep. Yeah.
So,
yeah.
Well,
there's actually 2 biofilm papers. One is actually focused more on Lyme and Borrelia biofilms.
Great.
Yeah.
Well, I'll have to find that one then. Well,
yeah.
Anyway, thanks for joining me.
Oh, you're welcome. You're welcome. Happy to be here.
So what I really wanted to talk to you about, we're doing this podcast on PANS and PANDAS, but I really wanted to talk to you about that in patients with underlying neurodevelopmental, behavioral issues, kids on the autism spectrum. Why do you think that's important to talk about?
I think it's important, and I want to just kind of explain, just in terms of patients, why I think it is.
Yeah.
Because kids with autism, and they already have a lot of behavior issues and developmental issues and issues with, language sometimes and being able to speak how they feel. So when do you determine, okay, we need to really think about this autoimmune issues as opposed to some of the others? And so I had a child, one of the sickest kids, who did not have any neurodevelopmental issues. And he came to me, he'd already done IVIG. He was a child who actually was neurotypical 8 and literally went to the point where, he couldn't write. He actually stopped speaking, really pretty severe outcome. It almost looked like a child with autism. So he had, positive antibodies for all these different infections. We started treating him. He'd already done IVIG, and he ended up going to Children's Hospital, and this is in Colorado, and got plasmapheresis. And the result was incredible and how I made progress. And when we did blood work, it was like it had taken all these antibodies, and all the antibodies, all the blood levels were really low. Like I'd never seen anything like that before. And he returned talking. He actually did really incredibly well. And they finally found the source was like a staph sinusitis.
Wow.
Anyway, so I'm seeing this. I'm like, wow, this is amazing. This child got so much better. A lot of his antibodies, a lot of infection markers, he did have some residual symptoms, but just like the change, I'd never seen it. And I'd never had a child who did plasmapheresis before. So I had one of my sickest children with autism who I've known forever. Um, and we're like, he was on an IVG. There's an immunologist in Denver who does like IVIGs, and he was doing like every 3 week course and everything else, even got worse doing that. And I'm like, why don't we think about plasmapheresis? So I sent him to Children's Hospital, and the pediatric neurologist is like, no, he doesn't, because he has
Hmm.
autism. No, he doesn't have PANS PANDAS. And I was like, and we had a positive Cunningham panel. We had all this information on him. And I was like, this is already a child with neuroinflammation, he had some other autoimmune issues, thyroid issues, all sorts of things. And he's like, no, so we won't do it because he doesn't. And in the meantime, I had also sent another child on the autism spectrum to children thinking the same thing, and they got the same response. I was like, so why is there a difference, and why would a child basically not have it? And that's kind of why I started thinking about it. Like,
Yeah.
have these neural antibodies, like why, anyway, so that was kind of my experience and made me start thinking about this. Like, well, this doesn't even make sense to me.
Right. And I think as practitioners, especially those in conventional medicine, we get so stuck with labels. Well, the child has
Yes,
autism so it can't be PANS. Well,
right.
really, it's an infectious, triggered autoimmune inflammatory response. And like you said, both of us have seen kids that got the diagnosis with autism after an abrupt change. And actually,
Yeah,
when we treat the inflammation, when we treat the underlying root causes, that label goes away. And I think
right.
it's so important to look at the underlying markers. Go ahead.
Oh yeah, that's what I was saying. It's like and it really makes sense to me that these children would actually be at higher risk, right?
Right.
Their immune systems are imbalanced. They've already got inflammation. I said neuroinflammation, and kind of prone. So why wouldn't they be like actually one of our highest risk populations? And so to not even think about that, I was like, this makes absolutely no sense.
Yeah.
So, and the additional thing is one of these children, he was already being treated for Lyme, originally from Massachusetts family, and yeah, had Bartonella, had Borrelia, and it was like, how is this, elevated mycoplasma? He had everything. He was one of my
Yeah.
everything, EBV, everything, he had terrible Clostridia. So I was like, how is he not at one of the highest risks for this?
Right.
And to
Right.
not,
And there's an excellent point too, because, so many of our kids, the parents get so upset, well, I thought it was just strep, and now he has Bartonella and Babesia, and now he has
Mhm.
viruses and he has mold. And
Yes,
and what we have to remember is this isn't an infectious disease. It's an
right.
immune tolerance disease. It's a lack of appropriate immune response. And so, yeah, you can have a zillion triggers. And you can have other diagnoses, either previously or, like you said, in that one kid, no previous neurodevelopmental diagnoses, but now
Mhm.
an abrupt onset of what looks like autism. Well, that abrupt onset may well be this diagnosis.
Right. Yeah. And that's why I wonder, I said I trained in medical school in pediatrics a long time ago, or even when I started in kind of integrated, pediatrics, this, oh yeah, maybe pandas, but like the whole PANS are thinking that it was other infections. And still, it's like, it's still people don't kind of think about it. And I think and I feel like I'm seeing more and more kids. Like I know once you start seeing kids, you see more and more kids like that, but it just seems like it's so prevalent. And, they
Right.
come to you, the parents are just, kind of, and sometimes they figure it out after they've seen many, many doctors and like, hey, can somebody do this? Can they treat this?
Right. I mean, from my perspective, I learn more from parents than almost anybody else, and
Yeah.
Sid, Dr. Baker used to always say to me, if you listen, they will come. And I think
Yeah.
that's an art of medicine so much of the time, with the rapidity with which we need to see patients, the volume business in pediatrics, that we're not listening to what they're really saying, and we can learn so much from them.
Yeah, I did general pediatrics for a while. And looking back, I'm like, you think about what I didn't, think about. And then if you had somebody with chronic illnesses, it's crazy.
Yeah.
And just starting to see a few children here and there with autism, you're like, this is interesting.
Yeah. Yeah. And by definition, PANS and PANDAS are abrupt onset, abrupt changes in behavior. From your perspective, in the kids with neurodevelopmental issues or autism, how does it present? Give me some examples from your
Yeah.
perspective.
Well, I said this one child, and I said there's always kind of behavior things. One of the things is, kids with autism, they're not, everything's not the same. Like they seem like they go through better stretches, worse stretches, and kind of goes up and down. And sometimes it's even hard to figure out kind of why. But one of his children I had, who said pretty severe autism, he started waking up at night screaming and not sleeping. Like absolutely, and had a lot of allergies. He had so many different things. It's hard. But literally all of a sudden out of nowhere, kids slept, kids with autism have sleeping issues, but literally up at night screaming.
Yeah.
And they were like pacing and up all night with them repetitively. And it literally, I still remember it was like the third week in April. And this family is calling me and just is like, what is going on? And I said, trying to figure this out. And he was one child. I actually ended up trying steroids, which didn't help. And I said, I don't really do that anymore. But he walked out with more prescriptions. I'm like, I'm an integrated medicine. And he just walked out with more prescriptions than I ever gave as a general pediatrician because
Wow.
we had to like get his behavior. Nobody was sleeping. We had to get the inflammation down, figure out like, what are we missing? But it was, it was really severe. I had another child, I think a child, but he was like a teenager, but like a very large, he was huge, so some of these kids, if they're really out of control, it's actually scary.
Yeah.
And he just really had some of these rage behaviors where like, in school, and then the parents felt like that they were going to be hit, he was going to hurt himself, and it was just kind of, and he's always kind of, and I said, I've known him for years, and he's just kind of, he wasn't like that, and yeah, some verbal skills and everything else, but just, literally rage, like frightening rage. They had to call the police at some point, that kind of things. Those to me are like really, really
Right.
acute,
Right.
and then when I saw him, and then he actually had the Bartonella stria. And
Ah,
then but it's hard, but it's like, as a pediatrician, oh, well, he's overweight, right? He's heavy, he's like 300 pounds heavy. Of course he's going to have the stria, right? So it was kind of looking at them and they were bright red. And I was like, they're not where you'd think they would be kind of stuff.
I'd like to thank Nutrimetics for sponsoring this podcast. Nutrimetics is a company specializing in high-quality herbs, botanicals, and nutraceuticals. They have formulated research-based tinctures critical in the care of children with tick-borne diseases such as Borrelia, Bartonella, and Babesia. But also important is that they are a company with integrity, with charitable purpose, and with a goal of helping clinicians care for the families in their practice. If you do not yet know about their practitioner support programs, their lunch and learns, check out more at nutrimetics.com. And thank you. Yeah. And
So
just for our listeners who may not know, the Bartonella striae blanch. They're often much deeper purple, deeper color, and they blanch when you touch them. And also, as you're saying, they're in a different distribution than they are when you have weight changes. And the Bartonella stretch marks are much more either vertical or horizontal, not following the dermal lines that we see in the other kids. So were you able to treat the Bartonella in that
yes,
particular child?
yep, yeah, we did. But I said, oh, really, because I said he's overweight, but they were like across his back.
Yeah.
You know
Yeah.
what I mean? Or you just kind of like, they seem really random where they are. So, and I remember that, but yeah, he was one. What about the kids who, and I'm sure you've seen this, like the kids who, bad behavior, whatever, and you're not quite sure, and then they go on antibiotics, and strep throat, and then they get better and they start
Right.
to improve.
Right.
I think
Exactly.
that's important to kind of keep,
Right.
think about it. Or obviously if they have like a recent infection, or the thing I see sometimes is like, well, his sister had strep throat, but he didn't have strep throat. But then they have the behavior change and then they got worse and the sister's fine,
Exactly.
which I
Yeah.
always thought is interesting,
Yeah. I mean, they get the infectious, but their antibody response is dysfunctional. And so rather than attacking the throat where they'll get the symptoms of sore throat and fever and all of that, those antibodies are attacking the brain and causing the behavioral changes. But they still need to be treated, just like
Right.
their sister. But it's not seen in that way in most of our medical community. So that's why we're here
Right.
trying to help people see these things, you know.
Right.
And I think the other thing that you mentioned about the abrupt change in these children, you know, sometimes that abrupt change happened when they were very young. You know, they got that strep
Yes.
infection and they were
Hmm.
off, you know, they had a little bit of anxiety or maybe a little bit of behavioral changes, but they went on antibiotics and they immediately got better. And they just saw it as, well, the kid was sick and then they got better.
Right.
But if you delve into that in the history, when now they're coming to you 7, 10 years later, and
Hmm.
all of a sudden it's severe and they are having episodes of psychosis or very severe anxiety or you know, whatever their symptoms may be, tics, OCD, and you go back in the history and you say, well, that was the first one when they were 2 or 3. Now this second one is much more severe, but still PANS PANDAS, you know.
Right.
So
But
um,
I do, as I said, as you get, you treat like, the people with more severe autism, you find back. But I feel like a lot of these kids, by the time they get to me, it's been years,
yeah, yeah,
years.
absolutely. Yeah,
So, and that to me is always like, how these kids and how their families are just, and it seems like, yes, there's like, I often see it seems like there's some kind of, issues and then something happened and then things got really bad. But
right,
then
right,
it's years that they're dealing with this. And the kids
absolutely.
aren't in school, kids aren't functioning, they're not social, nobody's sleeping. I mean, it really can be, I think people need to know how disruptive this really
Right,
is.
right,
It affects the
absolutely.
whole family.
And one of the things you mentioned a couple of minutes ago was about sleep. I mean, you know, sleep is so important for all of us, you know. And so if the child's not sleeping, usually nobody in the family is sleeping, at least one of the parents isn't, and that it disrupts everything. But also, we both know your immune system regenerates when you're sleeping. Your lymphatic system drains. We detoxify while we're sleeping. So I often say, you know, sleep is the most important thing I've got to treat early on
Yeah.
because otherwise they're not going to detox appropriately. They're not going to regenerate their immune system appropriately, and they're not going to get better.
Yeah, and then it just the tolerance, they can't get to school, they're
Right,
exhausted, makes all the symptoms worse. And the parents, like talk about really stressed parents and just, they're trying to function also, and
right.
they're at the wit's end, they just don't know what to do. And I was talking to a mother yesterday, she's like, yeah, and somebody said, like, did you look at your parenting skills? I'm like, we're not bad parents, we're really not bad parents, like, they're just insinuating. I mean, we're not perfect, but we're not bad,
I
so
know.
I think that
And you
is,
know, one of the reasons I wanted to do this is there's so much blaming of the family, of the child, you know, and there are ways that we as parents, you know, can feed the beast of this disease and make things worse. But in general, you know, these families are so suffering, these kids are so suffering, and we need to come to this with compassion and grace and listening and not blaming them for being bad parents or bad kids.
that doesn't help anybody get better,
No.
or even think about, like, trauma too, just trauma
Yeah.
responses. Some of these
Yeah.
kids, they've been through such difficult times at school or, socially, that just, long term as they get better, but just really, and they've lost years at
Yeah.
sometimes.
Yeah.
So,
And I always say, you've heard me say it, the most important instrument in my office is a tissue box. You know, because that
yeah.
of this stress that they've been through, and just being heard helps them to start to believe in some amount of hope. And there is hope, you
Yeah,
know.
and I think that is really important and get rid of the guilt and all that stuff. So, yeah, I
Absolutely.
know you have parents come and they cry
Yeah.
in
Yeah.
your office.
Yeah. Absolutely.
Kids.
Yeah, and you and I both know, you know, this is a clinical diagnosis. That history we're
Yes.
talking about the abrupt onset of anxiety or OCD or tics or eating disorder or whatever. But what about testing? how do you use testing to help you decide in these kids, especially those with autism, but how do you use it?
Yeah. Well, and things change as I've kind of done this longer and longer. So the Cunningham panel, they said I was saying the gold standard, but as much as, because I've seen it not accepted at children's hospitals, but I don't really do that as much. But sometimes the kids with the neurodevelopmental, I might be more often to do it. Because
Interesting.
some of the children, like say, if, people come in, the symptoms, I said, clinical diagnosis. And I said, if we're gonna like look at things, I look at the infections, like I look at causes. I'm gonna do like a good Lyme test, like the IGNX Lyme test, or look at mycoplasma titers, because Cunningham's, a lot of these they get expensive.
Right.
But some of the kids, like I still go back to this one child who, very close to the family, they're wonderful. But it was kind of like the things like, well, he's already been treated for, Lyme and Bartonella. Is this, really what we're thinking? And that's when we do it. And I said, I used to do more, but it's really when I feel like, is this really what's going on? Am I missing something? Do I need to go look at infections? Do I need to, like, am I missing certain infection? They always ask about mold history. It's really hard in my mind to get a decent mold history about exposure. So that's what really is. I'm like, okay, when there's a lot of different factors or I'm already treating them and they're not getting better, make sure I'm targeting the right thing. Does
Right.
that make sense?
Right. Absolutely. And I remember one of my first kids with PANS PANDAS almost 17 years ago was a young man with autism who came in, was nonverbal, had a lot of OCD, perseverations, to start with, but he
Yeah.
came in off the wall, like your kid that you just described, not
Yeah.
sleeping and just picking at his skin and raging.
Mhm.
And we found that he had a mycoplasma infection, treated it, and he went
Mhm.
back to baseline, which was great. But
Right.
then the parents stopped prophylaxis. And that's
Oh,
something that I think is important, at least that first winter season, to prevent
yes.
another infection. And they had stopped it, and the kid got worse again. And we must have tried 5 different antibiotics, done all kinds of regular testing.
Yeah.
And I thought, well, I'm wrong. Maybe he didn't get better. Maybe this isn't PANS
Ex-
PANDAS. What, maybe this is just bad autism. And they went to a psychiatrist and got all kinds of
Oh, right.
antipsychotic medicines that weren't
Hmm.
working. And he came in and did the Cunningham panel. And for our listeners that don't know, the Cunningham panel was developed by Madeline Cunningham for Sydenham's chorea, which is the rheumatic fever prototype for PANS and PANDAS, where there are antibodies that cross the blood-brain barrier and attack the basal ganglia. And specifically with strep and other germs, there's an elevation of this calcium modulating protein that shows that there's inflammation in the brain. And then there are other ones, as we both know, anti-dopamine, anti-tubulin, anti-lysoganglioside. But this particular kid I'm talking about, his CAM kinase was 206.
Yeah.
And, anything over, what do you say, 140, 150 is positive? What's your cutoff?
Yeah. I mean, that sounds about right. I said, I feel like I haven't done as many recently,
Yeah. And
you
I
know.
don't do that many. And I'm using it just like your kid that you talked about and this kid I'm talking about. It's an atypical case because it is
Yes.
an expensive test, and neither one of us want to take the family's last dollar and do it. So only when it's atypical or we're not sure, but it really can be helpful in those cases and tell you, yeah, we're on the right track. That particular kid, in my case, like yours, I couldn't get IVIG covered. I couldn't get
Oh.
plasmapheresis. He was my first child that I did Hellman therapy on. And
Oh, okay.
overnight he transformed.
Oh,
So
that's great. That's great to
yeah.
know.
But I agree
Um,
with you, the Cunningham panel. Go ahead.
Yeah, because for me, I mean, I'd rather if they're going to spend money, let's get all the infections, let's get all the testing that way, so we know exactly what we're going to be targeting, and then as with Cunningham. And there are some other, kind of antibody tests, autoantibody tests. And I actually had somebody who had a patient who had a Cunningham, and I don't know, but we like mentioning other like the neural zoomer.
Right.
And this is a child clinically absolutely PANS. and positive Cunningham, and the neural zoomer was negative. There was nothing on it. I was
Yeah.
like, okay, this doesn't even make sense. And then I had another child who came in and it looked like everything was positive, like absolutely everything, antibodies to all different parts of the brain. I'm like, this doesn't really make sense either, you know? So again, like sometimes it's like the common sense, like why wouldn't children with autism have PANS? You
Right.
know, kind of not thinking about, so you know, you kind of get your tests and how you use them, you kind of refine. But so that's what I said, the Cunningham is, as I said, when I really am like, okay, what's going on here?
Yeah, exactly. And I think it's important for the parents and the practitioners who are listening to really trust the validity of the test that you're doing and make
Yes.
sure there are external validation studies. And we've been lucky enough with many of the tests to be able to do split sample
Yes.
where we'll
Mhm.
send it, you know, the exact same child, the exact same blood draw, send it to two different labs, one that we trust, one that we're
Not
figuring
sure.
out. Yeah,
Mhm.
and that has helped us really trust things like the Cunningham panel if we need to do it, like IGeneX, as you were mentioning, for tick-borne
Right.
disease or Galaxy or others. And but look at the literature, look at the fine print at the bottom of the articles, and make sure that the validity is good and that the study that may have been published was published by people outside of the company or not paid by the company. So I
Right.
think
That,
that's really
yes.
important.
And
Yeah,
then it for me also, when you talk to, you know, you talk to these lab companies, you need to explain what this test is, what is measuring and why. And if I've had some people with certain tests, I'm like, well, it's this. I'm like, why is it the same thing for 10 different things that you're measuring? That doesn't even make sense to me.
right,
You
right.
know, so
So,
I do ask like little, you know, what's the mechanism? How does it work? And then, as I
right,
said, you just kind of find out what other practitioners are using also, like what they feel
right.
comfortable with, and then what you get to use. I actually did split samples and a couple stool tests, you know, because there's different, like the old
Yeah,
fashioned, let's look at it, you know, let's find the bacteria as opposed to some genetic test. And it's just interesting, you know, kind of the what you see and differences.
yeah.
So.
Yeah, absolutely. And, you know, when we talk about trying to save families money, you know, a lot of the tests we talk about can be done from our conventional labs. You know, you
Right.
mentioned mycoplasma titers, strep titers, inflammatory markers, you know, a lot of that can be sent to a conventional lab and save the families money too.
Right, and that's what I do. I said like, you know, the Borrelia, Bartonella, but BC especially, but all the other infections, as I said, I do regularly, and immunoglobulins, and obviously like the basic chemistries and nutritional markers and all that, which is very helpful.
Yeah. And
So
what tests do you do for immune and autoimmune issues?
it's funny, I was thinking about that because immunoglobulins, because I always want to make sure that if they're low, because then some of the other tests you might not really know the validity. You know, if the
Yep.
immunoglobulin's low and then you get low immunoglobulins on a, you know, like an infection panel, then is that valid? You know, if it's
Right.
immune sufficiency. It's funny, I used to do a lot more like SED rates and stuff. I feel like I don't see those positive. You know, the classic adult, you know, CRP and things like
Yeah.
that. Unless I'm really, I do ANAs. I find
Yep.
like especially the patients kind of with the Lyme, you can get a positive ANA.
Yep.
Um,
Yeah,
obviously blood
we've found
counts
up
and
to
in your gut.
60% have positive ANA. And, you know, Kiki Chan reported in the literature that 13% of neurotypical children can have consistently positive ANAs. But our percentages in our practice are at least 60% with a positive ANA. But I have to say that since COVID, I have seen a lot more positive CRPs than I used
Oh,
to.
what
And
about like the cardiac issue with COVID? Or like
right.
having COVID now? I feel like COVID triggers all these other infections, and then that's like can be a huge trigger for kids.
Absolutely. I see a
So I
lot of
think,
reactivation of EBV, mono,
mhm,
CMV, and all the tick-borne diseases, as you were mentioning.
yes. Yep,
Yeah.
and I definitely have patients who say that was a shift, getting
Yep.
COVID. Or, you know, as I said, talk about you know, the regression, because people are like, oh, you treat one infection and they're great. And then they go to school and they get the flu and then they regress. So
Yep.
I definitely treat these kids and I always keep something on board. Like usually like, you know, I have to treat the cute one, like herbals on board and immune support and anti-inflammatory, stuff like that.
Yep.
But that's the risk too. And I feel like You always risk if they really get a bad relapse, then, getting them better, you're activating the immune system again. You have to kind of get that under control again.
Right, right. And I always talk about the three-pronged approach, treating the underlying trigger, whether it's infectious or metabolic. Sometimes kids regress after anesthesia, and then treating the immune system. I think sometimes clinicians that are new to this want to treat the infection, but don't do enough for treating the immune system, short of IVIG and plasmapheresis. I mean, there are so many things we can do for the immune system. And then treating the symptom, whether it be not sleeping or
Yes.
the OCD. I mean, is the treatment different from your perspective in the kids with neurodevelopmental issues and PANS? How do you look at that?
I don't like the acute treatment. I feel like I'm much more likely to keep them on treatment longer and really
Mm,
keep them stable, just because if you have underlying immune issues, every time they, flare, so to speak, I feel like it's harder to get them back. So you
yeah.
really want to keep them like in the terms of stable. And I would have thought, like, I have, kids with autism have so many different infections and so many different things going on. They have candida, they have like GI issues. But I'm finding a lot of kids with PANS, like without the autism, still have like you find all these things that are positive.
Oh,
And I,
yeah.
I and I do think COVID's made things worse. Um,
Totally agree.
and I think the CRP, like the cardiac involvement of the COVID, like
Right.
the microvascular, maybe that's what's influencing the CRP. And if
It
that's
may
true,
be
that's actually frightening.
myocarditis. Yeah.
That's
Yeah.
actually frightening, because then we do have to think about like the cardiac inflammation or like involvement that way too.
Right. Right.
So,
And from your perspective, we've been talking about abrupt changes, which certainly by
right.
definition, that's what this is. But in my experience, and I'm wondering about in yours, there are children that present much more subacutely. And I see that certainly with tick-borne diseases. It's not
Yes.
necessarily an abrupt onset, or certainly with mold mycotoxin disease. Do you agree with that? Do you see any others that are more subacute, and how do you deal with that?
Yeah. And I think that's why I talked about kind of like, the children with autism neurodevelopmental, because, you know, they have so many things going on that I think it can be more. And I feel like you usually hear like this event and then this event, and you hear kind of, these kind of like subsequent things in terms of, so subacute, but it's like they were already not in good shape and then they got something else. And yeah. And
Right.
then people say
The tipping point, so to
the
speak.
tipping point. Yeah,
Yeah.
that's a good way to put it. And also, parents come in and like, well, I think they had a tick bite like 5 years ago, but then they got worse here. And
Yeah.
then, I said I'm originally from Connecticut and I've had Lyme. I was actually diagnosed with rheumatoid arthritis at one point and went back
Wow.
and treated Lyme and Babesia, and I don't have it anymore.
Right.
So it's like you can get yourself better. But I feel like, they've had Lyme, they got a tick bite, and then they got some other illness, and so it seems like they've had some things, but like something else triggered like reactivated Lyme, like COVID.
Right.
That's how I
Right.
think
And
about it.
often I find a lot that again, as I said earlier, the kid that got it at a very young age, it may have been abrupt onset then, but it was so mild it wasn't picked up. And then later it's more subacute. Well, they already have that
Had the
immune attack, so to speak, already, and then it can be more subacute. Do you see any differences in causes in children with neurodevelopmental issues, or
I was thinking about that also, and I'm not sure I do. Like
yeah,
a lot of these kids have candida and stuff. I mean, do you see a lot of candida, or I see candida, but there's also other things. So I don't know, like, is the candida really kind of the primary trigger of some of this, or is the mycoplasma that you have to
right,
kind of cover both of them? And then if they
right.
are like antibiotics, you have to deal with candida anyway, or prevention of it.
Right. And a lot of these
Mm.
kids that come in with recurrent strep, whether they're on the spectrum or not, have had multiple antibiotics. And
Yes.
so if they're not protecting or treating the gut, they definitely have other dysbiosis, like you're saying, yeast and Clostridia. And that has to be treated also, especially in
Mm.
these kids with autism. I agree with you. They're much more likely to have persistent other dysbiotic causes.
Right.
So, Yeah, absolutely.
The gut, even in kids who, I said, I'm think of kids without like the neurodevelopmental issues, sometimes they don't even have a history of gut issues, or even children, with autism, they have no history of gut symptoms and they still have terrible dysbiosis.
Yeah. Yeah.
So just because of like, oh, they don't have like an IBS kind of, picture or symptomatic, they can still, have dysbiosis. And a lot of the immune system, a lot of practitioners know a lot of immune systems in the gut. So it's really
Right.
hard to heal the immune system if you're really not addressing and healing the gut.
Right, right. And as we say, we have a leaky gut in so many
Mhm.
of our kids, that increased gut permeability. But what a lot of people don't know is we also have leaky brains.
Yes.
The blood-brain barrier, because of underlying genomic SNPs, or, with TNF alpha or mannose binding lectin or whatever, but also just our toxic world.
Yes.
And
Yeah.
I think, for me, our kids with autism, I grew up in West Virginia. I live in Connecticut now, so I
Yeah.
haven't been
Yeah.
smart enough to leave Connecticut yet. But anyway, growing up in West Virginia, we used to send canaries into the coal mines. And if the
Yes.
canaries died,
Literally.
literally, and if the
Yeah.
canaries died, that meant the mine was too toxic for the miners, for the people. But I think our kids with autism are much more sensitive. There are canaries. And we all live in this very toxic world, but those kids are just much more sensitive. So I think, yeah, we still do the three-pronged approach when they have PANS, PANDAS, tick-borne disease, mold, whatever. But we also really have to look at how toxic they are, how leaky their gut and their brain really are because of their susceptibility to our toxic world.
Right. And also nutritional. A lot of
Yeah.
these kids do have a lot of feeding issues, and just, hey, they're low in zinc, and zinc critical for immune system. So kind of, always thinking about nutrition and diet and the toxins and all that. So, but I do, it's like there's so many things that and the other things you can't treat absolutely, like toxins and this, and like there's so many things that gets a little overwhelming.
Right.
And you also don't want to make these kids like have complete die off and be really, really sick.
Exactly, exactly.
I
And
mean,
and
that's
I
another
think,
another issue.
the low and slow approach is really important. Starting low, slowly increasing, seeing what works and what doesn't in an individual child. But you're right. I mean, we can't overwhelm these families with 20 different things. And I think so much of the time we try to put them on something to fix it. Whereas if we
Right.
dive deeper into their lifestyle, are they getting out and playing in the dirt? Are they getting vitamin D exposure outside? Are they eating a nutritionally healthy diet? That if we spent more time doing those sorts of things, maybe we could pull back on all the other, you know, supplements or nutraceuticals we're trying to get into their bodies.
Right. And you think about it, so if you have a lot of children, I've done a lot of feeding clinics and nutrition, all children can have feeding issues, but in autism that's, a difficulty. But the other thing that I've been seeing more of is this, they have the ARFID, or the restrictive
Yeah,
eating. I'm like, that's an acronym that just became, and I think when I've seen that, every time I've seen that, it's been like a PANS picture. But they have
yeah,
kids who've been, literally malnourished, eating almost like 3 or 4 foods for years,
yeah, yeah,
and getting some pretty significant nutritional deficiencies,
yeah,
iron and zinc and D, as you mentioned, just these kids are like, they're not doing well. They're inside on video games, they're
yeah,
not out playing with their friends.
yeah.
So,
Yeah, and I find that to be very important because, we used to say the strict criteria was 20% of kids with PANS, PANDAS developed a restrictive eating disorder. I think those numbers have really risen, and there have been a couple of studies that show that it's over 30%, like 36% of the ARFID. And that's something we know from years that has been a problem in our neurodevelopmental kids. But when they get these infectious triggers, it gets even worse, I find. But I also find that sometimes, we'll do food sensitivity testing, and
mhm.
as clinicians, we say, oh, look, they're sensitive to all these foods. We've got to take them off every food
Right.
that they're
Yeah, and you
sensitive
can't.
to. Right. Right. That's really about that leaky gut.
The more you
And
see, the more likely it's leaky gut. And you can't take, the other thing, if you're eating 4 foods and I'm taking you off 2 of them, then these kids, like, I'm like, we need to get you better.
right,
And then we can deal like with what food, because right now you're gonna make things worse,
right,
you know?
right.
But yeah, I've kids coming in, they're like on these different things, and I was like, okay, this is not sustainable.
Right, right, right. And I think as clinicians, we have to make sure we're not iatrogenically making things worse. Of course, we don't want to do any harm, but sometimes when we focus so much, like on a food sensitivity or something else, we may be missing the bigger picture of health and nutrition that they need.
Yeah,
Um,
because I have,
yeah,
or patients, you get them, they've had, 10 years of this and they're failure to thrive.
yeah,
They're not growing, they're not gaining weight, or I had a child who had PANS who ended up in an eating disorder clinic for 5 months in
yeah,
hospital.
yeah,
And I'm worried he's actually going to be stunted because this has been going on for so long. And he's now going into teenage years, and I'm like, we really need the growth. We really need to address this now.
yeah, yeah.
And the parents have
But
been
we
like, I've been
also,
saying this for years.
right, right. But we also have to look at how we're refeeding them too,
Yes,
because
that's
so
true.
much of the time in these clinics or sometimes we just want them to get food. But,
Right.
as Stu Friedenfeld, a friend of mine, always said, there is no such thing as junk food. It's either junk
Right.
or it's food. And
I
eating
like that.
junk does not replace the nutrition. And I think that's missed a lot of times. And I always caution families, they want to get a supplement like a
Yeah.
Pediasure or
Right.
something like that. So look at the list of ingredients. What's the first ingredient? And it's usually some form of sugar. And
Syrup and soy
right,
is what
right.
a lot of them are, honestly.
Right.
Yeah.
And we really need to think about how we're helping that child in getting the best nutrition into them. And there are lots of other great products out there, Kate Farms, some we can make, et cetera, that are cleaner, so to speak, but still bring back the nutrition to these kids that have been underfed, malnourished for so long.
Yeah. And if somebody's really, really hasn't eaten very, very little, and you feed them too much too quickly, you'll make them sick.
Absolutely.
So that's something
Absolutely.
to think about. Or, they're like, people are trying to force feed these kids. Or like, I'm like,
Yeah.
okay, he's 3 things. They all have gluten in them. I don't think gluten-free is going to work until you get better.
Yeah.
It's not,
Yeah.
it's just like, mom's like flipped out. I'm like, I can't do it. I'm like, no, you can't. Because
Yeah.
we really still, this child still has to eat.
Yeah. And in these PANS PANDAS kids, it's the kids with the restrictive eating disorder that I'm also much faster to go to IVIG or plasmapheresis or even monoclonal antibodies because they can be so, so sick. And so much of what we need to get in orally, they can't do. And so those are often my group of kids that go faster because so many of my kids can get better without the IVIG or the
Yeah.
plasmapheresis, just with nutraceuticals, appropriate antimicrobials, other immune support, etc.
Yeah.
So
And I think talking about IVIG, because I've had, the classic, the pandas, you give one dose and they're better. Right? And I'm like, and I know there's high dose and low dose, and getting high dose, we can only get the children's hospital, and then low dose. So I haven't, and as I said, you're right. It's not something I'm always like, oh, you have to do this, you have to do this, because sometimes I'm like, I've seen kids who've done it and it really hasn't, it's not the game
right.
changer like that I originally learned.
Right.
So,
And going back to one of the other things you said, that a percentage of these kids, and probably about a third, have some amount of immunodeficiency. Their
mhm.
immunoglobulins are low, so they can't mount an appropriate immune response. Well, in those kids, they're often approved for low dose IVIG. And
Right,
if what their underlying cause is PANS or PANDAS, that low dose IVIG can actually make them worse.
right. It
They need the
doesn't.
high dose at 1.5 to 2 grams per kilo to get better from their autoimmune disease.
Yeah, the
Uh,
kids I've seen who do get better IVIG, it is a high dose.
Yeah,
And they tend to be, and maybe it's just like, as I said, kind of the children with autism. I'm trying to think if I have seen them get better with IVIG, but most of them are on kind of like the chronic IVIG, more the lower dose
right.
for, kind of on term. as opposed to the kids I've seen better, I've gotten the high dose
Right.
and
Right.
don't have any other underlying issues.
Right.
So
And
just
like
from
you said, it
my
used to be one
experience.
and done. But
Hmm.
but now we're looking more at, and I think some of this has to do with so many different causes, the tick-borne diseases we talked about, the mold, et cetera. But we're often seeing that you need a minimum of 6 treatments before you see real improvement in some of these kids.
Yeah.
Now, I'm not one of those people that would recommend it. They're not getting better after 3, 4, 5, 6 treatments. Well, just keep doing it for life. They're going to get better eventually.
Right.
No, no,
Right. And I've
they're,
had kids who've done it for years. I mean, with
yeah,
some immunologists, there's different clinics and they're getting like the lower dose every 3 weeks. And I'm like, I really, trying to figure out and right, getting covered, but I really haven't seen.
yeah. I
Yeah.
have a young man who for years was working with another doctor, a brain on fire doctor, and he had a mild immunodeficiency, and the doctor was only willing to do low dose every 3 to 6 weeks. And I kept
Right.
saying, years, we really need to try high dose. We really need to try
Mhm.
high dose, and met with resistance. When we finally did the high dose, his PANS PANDAS went away. His
Oh, that's,
symptoms
yeah.
went away. And I think we have to keep that in mind and know the dosage, not just that they're getting IVIG, but what dosage are they getting? What type, what form, because they're not all created equal.
I agree with that. Yes, and things that you don't think about in terms of referral. But I
Yeah.
think, and again, dose, I do think there's one that I haven't seen work as well, and I wouldn't remember the names, but it's like, okay, I think you're right. I agree.
Yeah. And we have some of our IVIG experts coming on this podcast later, so we'll let them tackle
Oh,
that problem.
yes.
So,
Oh, that's good to know.
yeah,
Okay.
yeah. So, but what about other treatments for infections? Some of these kids in our neurodevelopmental spectrum kids are already on a lot.
Yes. Yeah.
And sometimes I just pull back because I think they're on too much and I'm not really sure why they're on it. But what if they're already on treatments? What do you do differently there?
Yeah. So when I do like you're just targeting infections, I
Yeah,
usually do, especially when they're acute and they're really severe, but I do a combination of like, antibiotics, prescription, antivirals, antifungals, and herbs. With the
yeah,
idea, what I like to do is, and I start the herbs slowly and get the antibiotics on board. And as I get better, going down the antibiotics and then going up on the herbs and then keeping them on the herbs like
right.
for a long time. And
Exactly.
herbs are good because you have one antibiotic, it treats this infection, maybe one or more. But with herbs, you can treat multiple infections, but they also have a lot of immune properties and anti-inflammatory properties. And some of
Right,
them are even like calming or, helpful for mood and regulation, or, they can be antiviral and antibacterial and antifungal. So, and then somebody can put them in drops and it can make it easier, in the long term. But I usually start both and then with the idea of kind of continue with herbs.
right,
So that's
right.
kind of, how I've done it.
Yeah, and I'm right there with you. And
Yeah.
as many of our listeners may or may not know, you're now the director of product education and clinical research at Nutrimetics, a wonderful company that has a tremendous amount of really good herbs. Tell me a little bit about what you're doing there and what you're learning and what you're teaching others.
Yeah. So as I said, I've done a lot of training in functional medicine and even some herbs. Nutrimetics has some very like herbs a lot from South America and herbs that I'd never heard about.
Yeah,
So it's been a big learning curve, but really some unique herbs and the way they extract, it's like a double extraction. So very effective and easy to use even in low amounts, which is nice. And they have a couple combination products, but there's a couple I use, and you can really start with like 1 drop, a couple drops, which is really easy to kind of get into kids. And some
right.
like just even putting in their bottle. Um, like I've learned a lot more. Like I've always I do a lot of I have a lot of kids with like mood behavioral issues. So I have a lot of kids come in depression, anxiety, acting out, all that stuff. And obviously you look for PANS in that. But so there are a lot of different things, like natural things that I use for mood and calming. And I actually heard you speak about this Avea, which is turmeric. And
Yeah,
I'm like, I never ever thought about turmeric as being something that's calming, but it's
yeah,
anti-inflammatory, but it helps the brain. So there's some things that are really, or like using, like they call it Amateo, like valerian, or things that are calming and help sleep. Like, oh, I never knew you could use it more than just sleep. It helps you fall
Right.
asleep, but if you can help the stress response. And I'm also, always think about the fight. Like these kids are in fight or flight, right? They're
Right.
like, they are just sympathetic overdrive. And that is really, contributing to the symptoms. So I like to use a lot of adaptogenic herbs in
Right.
terms of just like trying to get them back to baseline, tolerate stress, just kind of get their system. So I usually use like combinations of herbs for both of those, like kind of the stress and the calming, in addition to like antimicrobial herbs. But I've learned a lot in terms of nutrients, and really kind of, we have an immune product that is coming out. I was like, when I came in, I'm like, we really need a mast cell allergy product. So we're going to have a big mast cell combination product that will be coming out. Because a lot of these
Great.
kids, right, the part of the immune system, when it gets really activated, the mast cells, the allergy cells, they just go crazy. And that's going to contribute, inflammatory cytokines and histamine and stuff. It's going to make a lot of symptoms worse. So I also think
Right.
about that as part of like, balancing the immune system.
Yeah,
So, and I help
that'll be
develop that,
amazing.
which is fun. But
Yeah, that's great.
yeah, and I look at the research like in each ingredient and what function, like, okay, we need something that stabilizes mast cells. Well, we need something that blocks the histamine receptor, or the histamine 2 receptor, or 3 or 4, how many ever histamine receptors they have, and trying to get different herbs. And again, sometimes the herbs are like, curcumin actually has some, mast cell, allergy kind of stabilizing.
Yeah,
So
and it's
things that,
neuroprotective.
right.
Yeah.
Yeah. So what I've started to do now, like I have a child come in, autism, mood, pretty much anything. And I'm like, okay, I just add this. I'm like, you're helping inflammation, neuroprotection. I'll add the Avea, mood, and then you can dose it and it feels very safe. I think
Right.
it tastes great, but I love turmeric.
Yeah, me too. Me too. And that's the
So
golden milk. People
yeah,
drink golden milk, with turmeric, and I would prefer a milk, an alternative to milk, like an oat
yeah,
milk or
oat
coconut
milk
milk,
or
but
almond,
whatever.
yeah,
Yeah. But it is calming and it is anti-inflammatory and it is safe. We've talked about so many treatments and antibiotics for infections. When we can use herbs effectively and safely, we can not only treat the underlying infections, but also, like you said, the underlying immune dysfunction, and not further debilitate the underlying gut dysfunction.
yeah. And I always make sure there's antifungal herbs.
Yeah.
Like that to me is key.
Yeah.
Just because, and we don't really have a lot of good antiviral prescriptions. There's a few, but they don't even really cover some of the things we see all the time. So I always want to have something antiviral. But I like, in terms of if I have antibiotics, I worry about resistance. I always use more than one antibiotic.
Right.
But I also like the herbs because you're just kind of, they're meant to be used together.
Right.
So, right, with the idea. So, yeah, I've been
Right.
doing that for a long time. But then I'm like, you're going to stay on the herbs for a while.
Yeah. And that's the thing. You also feel safer with the length of treatment because
Right.
in these children, many with tick-borne disease, with mold, certainly those with underlying neurodevelopmental issues, the length of treatment can be very, very long. And,
Mhm.
and so I feel much safer using herbs for that period of time. And I'm thrilled Nutrimetics is doing the mast cell piece.
I'm
That'll,
like,
that'll be great.
yeah. And then I said another kind of, immune kind of boost natural K cells, natural killer cells, kind of like help fight infections kind of thing. And I think that that's going to be great too, in these kids with PANS, because we do need to do the immune modulation and the
Absolutely.
anti-inflammatory part. And I tell parents that I'm like, you know, their immune system isn't working the way it is. They didn't get
Right.
strep, they don't get a fever. Oh, they're always healthy. I'm like, yeah, but they're still having infections. They're just not showing them the
Right.
way that they should and get better. Like the
Right.
parents who call you, like, child got a fever. You're like, yes, that's great.
Exactly. Yeah, I know. I know. And they're like, what? He has a fever. Did you hear what I said? I'm like, yes, I'm
Yes, that's a
thrilled that
great
he's
thing.
mounting that appropriate immune response.
Right.
And it's always funny, one of my former partners 30 years ago, back then was of the ilk, let them have the fever. And
Yes,
that's
I
the
am
way the
too.
body really helps us to get better. Yes, we
Yeah.
want them to feel well, put them in a tepid bath, give them plenty of fluids, good old chicken soup, more
Yeah.
turmeric, but
I use
that
essential
fever is
oils,
a good
like,
thing.
essential
Yeah.
oils too, in terms of being able to breathe and all that kind of stuff for cooling and calming.
Absolutely. Well, Debbie, we've talked about so many things,
Yeah.
and so many considerations in our neurodevelopmental group that also may have PANS and PANDAS,
Yeah.
the treatment, both the link and the types, the things to consider in the gut and the immune system. I really appreciate all that you're doing, with the kids in your practice, with NutriMedics. Do you have
Yeah.
any other pearls, any other things you want to leave our listeners with?
Yeah, I think if you just get the idea that you can have PANS in children who already have underlying issues and you don't miss that, because I think
Right.
it's so important that you don't miss that. And I mean, miss it in anybody, but miss it in these kids just because you think, oh, no, it's just the autism. I think
Right.
that that's probably the number one thing that's important
Absolutely.
to know. So,
Yeah. And we at aspire.care wrote a whole piece on PANS and PANDAS in children with autism.
oh,
So
that's
if you
great.
want more
Yeah.
information there, aspire.care. If you want more information about all the great products that Debbie was just mentioning that are coming out at NutriMedics, that's nutrimedics.com. And Debbie, thank you again. Thanks for talking about this subject. Thanks for being on the podcast, and thanks for doing the work you do. I really
Yeah,
appreciate
you're
it.
welcome. Well, I really appreciate the invitation. I always love talking to you. I always learn something, and it's great to get the information out there. So thank you
Yeah.
very much.
And we'll see each other again soon.
Okay, sounds good. All right.
Thanks for joining us.
Okay, bye-bye.
That's it for today's episode of Demystifying PANS PANDAS. I hope you're walking away with insights, tools, and hope to help you and your child on this journey. If you found today's conversation valuable, be sure to subscribe so you never miss an episode. Share this podcast with anyone who might need it. It could be the lifeline they're searching for. And if you have a moment, leaving a review helps us reach even more families who deserve answers. Also, for more information, training, and community, check out our website, drohara.com, and join our annual membership. And remember, every step forward, no matter how small, brings us closer to healing and understanding. Until next time, be present, be hopeful, and we look forward to seeing you next time on Demystifying PANS PANDAS.